Hello, my name's Donna Regbeer. I'm one of the consultant breast surgeons here at the Breast Centre in Cardiff. We're trying to put together some videos to help you self-manage at home. These series of exercises should follow on from those that you've been looking at in the BAPS app. We're hoping to cover some of what our specialist physiotherapist Tor would have covered in her one-to-one sessions. But we are hoping in the next few weeks to develop a Ask the Experts question and answer session. So if you do have any questions about exercise or breast cancer, then please do email them to thebreastcentreuhl@gmail.com. Thanks.
So normally at about 2 to 3 weeks post-op, we would ring our patients at home here in Cardiff and find out how they're getting on with their exercises. Normally our patients will go home with an exercise sheet and they'll be using the BAPS app to progress their exercises. They get offered a one-to-one where I can come and see me and we can go through the exercises, and usually at that point patients are falling into two categories. Either on one hand they are struggling with the exercises and finding either it painful or restricted in their movement, in which case I can help to support that and we can try and adapt some of the exercises, or they're doing well and they're ready to progress. So the first exercise we're going to look at is for those people who are struggling with lifting their arm up above their head. And this one is called Child's Pose in standing. So Donna, what I'd like you to do is put both forearms on a raised platform. So ideally, a kitchen work surface is great for this. We're going to loosen the shoulders and make sure everything is floppy because we don't want to be tense. And then take one foot back behind you, step back, and we're going to shift our weight onto the back foot, head down between the elbows and back up again. Everything in the arms should be loose and relaxed, and the lower body is doing all the work. And we're just going to move slowly and gently through the movement. The second stretch we're going to do is using a wall. So Donna, if you'd like to place your hand on the wall at about shoulder height. And we're going to rotate the body away from that wall, slowly moving around until you feel a pull. At this point, some patients will feel tingling or a tightness in their fingers, and that's from a nerve stretch. So if you're experiencing that, close your fingers into a fist and try it again, and hopefully that should ease that issue. So you're going to feel a stretch and come back off it. Nice and slow and controlled, rotate away and then rotate back towards the wall. And then we're going to take the hand further up the wall, so higher position, and repeat. And that will just change the direction. And then back. And then lower the hand to a lower position and repeat. And again, that will change the direction of the pull across the top of the breast tissue. And back. So for this exercise, you're going to need to lie on the floor or on a large bed where you can outstretch your arms. So for this exercise, I would like your arms to be as loose and as comfortable as possible. Let the weight of your arms sink into the floor or the bed and have them at a position where it's comfortable for them to be lying nice and still on the floor. Then we're going to bring the knees up and roll both knees over to one side. Feel the stretch diagonally across the whole body, and if that's comfortable, you can kick the top leg out over the top to increase the stretch. Then return back to the middle and repeat on the other side. always comparing one side to the other. The next exercise we're going to show you is using a pole. For this at home you could use a broom or a mop, just make sure it's dry so you're not spreading water all over your kitchen. So we're going to take the pole and at nice wide hands we're going to just push with the bottom hand and let the top arm relax into an upward stretch, and then take it the other way and do the opposite side. Always comparing one side to the other. Nice and slowly, side to side. The bottom hand gives the push, the top hand relaxes and gets the stretch. So some patients will come in experiencing what we would know as a frozen shoulder or a capsulitis of the shoulder joint. This is where the shoulder doesn't roll nicely, the ball and socket's not moving the way it should. And rotations of the shoulder joint are the key issue here. So for this one we're going to use the pole, we're going to keep the elbows nicely into the side, and we're going to, with one hand, push the other one out towards the side until we can go as far as we can, and then compare it to your other side. So you're pushing out, the elbow stays where it is, and the wrist moves out to the side. So for this stretch we're going to use a towel. Donna is going to do it so that you can see what it looks like from the back, and I'm going to do it from the front. So this is for patients who are struggling to get their hand behind their back. So what we're going to do is we're going to take the towel, pass it over your head and grab onto it with your affected hand, and then we're going to pull up and we're going to relax back down. So use the towel, pull it up, and the hand should raise up behind your back and let it back down again. Hopefully you found these exercises useful. If you struggled with any or you need more support, please get in contact with us through your breast care nurse or via our email, thebreastcentreuhl@gmail.com.